Welcome back to San Antonio Living. You just saw Alana getting her Zumba on, but what if you exercise and you work out and you still can't get that weight off? You might need a little extra help. And so this morning we have the Texas Center for Medical and Surgical Weight Loss with us. Dr. Alan Alvarez is here. It's good to see you. Thanks for coming.
Good to meet you.
Tell me a little bit about what you guys do at the Texas Center for Medical and Surgical Weight Loss.
Sure, you bet. We offer 3 options. We offer lap band, sleeve gastrectomy, or the gastric bypass for weight loss. Usually our patients have 100 pounds or more to lose.
You know, and sometimes it's hard. I mean, there are various situations going on with your body that keep you from taking the weight off. And so if you meet the requirements to work with you at the Texas Center for Medical and Surgical Weight Loss, then this is the perfect option for people.
Absolutely, absolutely.
Okay. Let's talk a little bit about medical conditions too, because I know a lot of people have problems as a result of their weight, like sleep apnea.
Correct.
Things like that. You can fix some of those problems by losing weight.
Sleep apnea, about 95% of our patients gets resolved.
Okay.
And that's a big one because the sleep apnea can cause heart disease and liver disease as well.
Okay.
And that's one of the major ones. Hypertension, of course, diabetes.
And we've talked before about some of the requirements, the weight that you need to be, the BMI that you need to have to undergo these surgeries. But a lot of people don't know what happens after the surgery. So we've got patients here this morning who have undergone different surgeries, and now they're here to show off their results. I'm very excited.
I'm very excited too.
All right, well, let's start with Julie. Julie is someone who came to you at the weight of 261 pounds. She was having problems with sleep apnea. Tell me about the procedure that she had.
Well, she had a sleeve gastrectomy, remove about 80% of her stomach.
Okay.
Now that's going to cause restriction, but there's also a hormonal benefit of weight loss, so her metabolism is going to speed up right away.
Okay.
Now Julia actually had a lot of problems with her back, so she had degenerative bone disease, so now she's getting all this weight off, and she's seeing marked improvement. We'll let her talk about it.
Are you ready to see Julia now? You look amazing, Julia.
Thank
I'm
you.
so excited for you. Oh my gosh. Just to see your face light up. I know you're so excited about how you feel too. Tell me a little bit about what the experience was like and how you're doing.
It's so amazing. I have a life back. I never thought I was just almost in a wheelchair a year ago.
Wow.
So it's amazing to be able to move. I tour internationally and have 3 jobs and absolutely love my life.
Oh my gosh. So about 86 pounds lost at this point.
92 now.
92?
And 66
Way to go.
inches.
Oh
66.
my gosh. That is amazing. I mean, that is something that is so hard to do. I mean, just congratulations to you.
Thank you.
Good deal. Thank you, Julie, for sharing your story with us. So she had the sleeve gastrectomy. What's the difference between that and a gastric bypass?
Well, the gastric bypass, I call it almost like the Cadillac of weight loss surgery.
Okay.
It's a little bit more involved, a little bit more surgery, but it adds more mechanisms of weight loss.
Okay.
Not only the restriction, but it has another metabolic benefit.
Okay, and our next patient
Jennifer.
actually had that gastric bypass. Her name is Jennifer, and this is what Jennifer looked like before. Tell me a little bit about what Jennifer was dealing with as far as the weight gain.
Well, Jennifer was actually in the forces before all this, and then she had a family, and she was really hard after the weight gain, and she was looking at things like sleep apnea.
Okay.
And she was just trying. She was trying to get the weight off, and it just would not come up. So we helped her out, and,
And
she
it's
looks
come
great.
off now. I know.
It's only been 8 months, and
8 months?
she's over 100 pounds.
113 pounds lost. Here is Jennifer now. Yay, Jennifer! You look amazing.
Thank you.
What is it like? Look to your right and see the person that's next to you. What is it like to look at that person and know how you feel now?
When I look at those pictures, I don't even feel like it's myself.
Yeah.
I can move. I play with my kids. I have an 8 and 10-year-old, so they keep me moving. And I can do that now. Before it was so hard to even get out of bed and go with them anywhere. So.
Let me ask you about, cooking for your kids and dinner time and lunchtime and things like that. Have you been able to make some changes and kind of, is it hard to eat with your kids, or is it something that's manageable?
No, it's manageable. It takes time. I'm still adjusting. Like we said, 8 months is very short time to get adjusted. I just make, it's healthier now. We don't cook with butters and those kinds of things anymore. And I actually eat basically the same portion they eat. So
Wow. Well, congratulations. You look
you.
amazing.
Thank
Yes.
you. You guys look great.
And it's so important to be able to share that kind of knowledge with your kids and help them understand how to eat right
Yeah,
as well.
absolutely. It's not just about the surgery. It's
Right,
about
right.
incorporating a lifestyle change. There's basically high quality protein and fresh vegetables.
Okay. Our
Yeah,
next
yeah.
patient is Sandra, and Sandra is someone who also underwent the sleeve gastrectomy surgery, and she started at about 191 pounds. Are you ready to see Sandra now? It's amazing. Wow, you look awesome, Sandra.
Thank you.
Very cool. What brought you to the Texas Center for Medical and Surgical Weight Loss?
I was at my wit's end. Nothing worked. I
Yeah.
tried every diet, lifetime member of Jenny Craig, everything else that's out there. And when I finally decided to do, I thought it was a crutch, and it's not, it's a tool. And when I finally decided to do something about it, there's no going back. I am very active now. I work out 6-7 days a week. I'm loving life.
I'm so excited to hear that, and I have to congratulate you. 86 pounds lost so far. Woohoo! Excuse me. Amazing, amazing,
indeed.
amazing. And I really like what Sandra said. She said this is a tool.
Correct.
Because, you know, once you get that weight off, you're able to get out and
Right.
do more and lead a better lifestyle.
Absolutely,
And that's what
absolutely.
this is all about.
Sometimes just getting over those first 20, 50 pounds,
Yeah.
and then you're just a new you're just a new person.
Yeah, you shed the weight, you're
improves.
moving around more.
Now Sandra's out 3 years, and she calls herself a gym rat. So
Oh
she's
my
really
gosh.
at the gym. She's really hitting. So she's
I love
a
it.
success story.
Well, thank you, ladies, for sharing your stories this morning. Hopefully, we've inspired everybody out there. If you've got questions, you can certainly call the phone number on your screen. It is the Texas Center for Medical and Surgical Weight Loss. Do we have a special offer for the San Antonio Living viewers? It's a free verification service for your insurance. All you need to do is give them a call, and they'll let you know if this is something insurance
Absolutely.
will cover, which is amazing. So the phone number is there on your screen. And again, Texas Center for Medical and Surgical Weight Loss, Northeast Baptist Hospital. The phone number is on your screen. You can find them on Facebook, Texas Bariatric. They're also on Twitter as well. All right, still to come on San Antonio Living. Do you love yoga? Well, there's an app for that, and it's What's Trending. But up next, our pet pal is here, and she's feeling fancy, because that's her name. Stay tuned, and we'll introduce you to her.